This movie will present you the reality of pulmonary inflammation associated with Mannheimia haemolyptica, one of the most frequent bacteria involved in bovine respiratory disease, BRD. BRD is a common disease that affects cattle lungs, and more precisely the alveoli, where the respiration process takes place. Healthy alveoli are constituted by alveolar macrophages and two types of pneumocytes, Type 1 and Type 2. The exchange of gases for respiration occurs through the pulmonary interstitium between the alveolar airspace and the pulmonary capillary. Following a stressful event or a viral infection, Mannheimia haemolyptica get access to the lower respiratory tract and infect the alveoli. The first act of the inflammation process is the activation of the sentinel cells, the alveolar macrophages. Activation of alveolar macrophages results in the liberation of several key messengers of inflammation, the cytokines. Three main pro-inflammatory cytokines are released. Interleukin 1 beta, responsible for endothelial leukocytes attachment and leukocytes chemotaxis. Interleukin 8, a major inducer of neutrophils chemotaxis. TNF-alpha, a major cytokine implicated in the increase in vascular permeability, fever, and pulmonary edema. One of the most dramatic effects associated with the release of these pro-inflammatory mediators is the migration of a large number of neutrophils from the bloodstream to the alveolar space. In parallel to the influx of neutrophils in the alveolar airspace, Mannheimia haemolyptica liberates lipopolysaccharides, also known as LPS. LPS are large molecules consisting of lipid and polysaccharide that are major components of the outer membrane of gram-negative bacteria. Their liberation is associated with the activation of the arachidonic acid cascade, which plays a key role in inflammation. The presence of LPS in the alveolar space also triggers a second wave of recruitment of neutrophils from the capillaries. Additionally, Mannheimia haemolyptica release leukotoxins during logarithmic phase growth. These leukotoxins are lethal to ruminant leukocytes, neutrophils in particular. Cytolysis of neutrophils by Mannheimia haemolyptica decrease the immune response of the host and cause the release in the alveolar space of the toxic materials that is usually shut down inside neutrophils. This sequence of events induces acute damage to the pulmonary epithelium. Inflammation is a frequent manifestation of BRD. The entry of bacteria, such as Mannheimia haemolyptica, is characterized by the induction of a severe inflammatory response that can cause destruction of lung tissue. Control over this excessive inflammation is advisable.